So I just wanted to really use this space to reflect on a lot of the initiatives that we've developed over the last year, some things that we're hoping to bring, and particularly to flag some really exciting new projects that have literally just come onto the platform or are coming onto the platform. And as my team will know, I have a slightly unhealthy obsession with Disney occasionally. I also have, who will remain nameless, an incredibly talented singer of Disney songs in the team, so you'll have to guess who it is. And the reason I thought, let's start with Moana, is because actually this does feel like it's, you know, since we spun out of the University of Cambridge, we've been on this incredible voyage across choppy and exciting seas, but I've modified it a little bit because I think we do know exactly where we want to go. I think we've made huge strides, and that's what I'm going to share with you over the next few minutes. So I think you've heard this a lot today. I mean, Mary and Joanne have given really powerful and brilliant accounts of the projects that they've done in collaboration with Discovery. And obviously you heard me already talk to the other Joanne about what we did in the remote monitoring of kidney work. So what we really do at its heart is we bring together people who have a question which needs answering with the people who have the expertise and experience to answer it. But what we particularly try and do is make sure that that means we're delivering really great online projects and we're really focused on those actionable insights. So I'm going to run you through a few innovations that we've been introducing. And the first, unsurprisingly, is leveraging technology. And we work really hard to do a lot of research, a lot of consideration, a lot of thought before we introduce new technology or new features into the kind of Discovery world. So we do know quite a lot, and we're quite cautious before we introduce something. However, as those of you who are Terry Pratchett fans might know, it still feels like magic, even if I do fully understand how this new technology is benefiting us and can benefit you. So I wanted to flag two initiatives. The first is new approaches to text analysis. Now, I know AI is buzzy word at the moment. And I come from an academic background. I used to teach approaches to analysing interviews and focus groups and ethnographic observations, and we tend to use an approach called thematic analysis. And actually, there's a lot of talk about how AI might support thematic analysis, but it's in its really early days at the moment. So that's not quite going to help us yet to be able to process the level of text that we can collect in some of our Discovery projects, where we tend to have very open, very reflective questions, because we really want to hear from people about their views and about their experiences. So I've been looking outside of those traditions, and actually there are a number of very robust AI-driven approaches that, although they take a slightly different approach, they're doing something slightly different to a thematic analysis, that sort of careful, people-powered analysis, which is so important. But we have got ways now that we can really quickly crunch huge amounts of free text. So we are very delighted to offer a kind of new approach, which is based on natural language processing and computational linguistics. So it can undertake analysis of any textual data, particularly, as I said, free text survey responses or interview transcripts. And its particularly focuses on looking at the difference in language use. So for example, how are patients talking about something compared to how are staff talking about something? And it offers huge speed, like a day, to process a huge data set and give like the headline descriptive accounts. It is really transparent, and I think you can be therefore confident that if you've heard from 1,500 people with a lot of free text survey responses, you are accounting for every single one of their views. It is totally different from the kind of very careful analysis, for example, that Mary's just been presenting, but it is, however, incredibly powerful and useful. So that's one exciting new innovation. And the other one is linked, and there's also about AI. However, AI is something that's really highly developed when we are thinking about the straightforward transcription of audio files such as interviews or other recordings. So we also now have a AI-driven transcription service. So any interviews that are done on the platform can be transcribed almost immediately. And the software that we've partnered with also means that you can, for example, listen back, stop, start. You can actually highlight and summarize and start building news stories around your data. So instant access to data, low cost, and guaranteed privacy, because it's not a person listening to it and transcribing. The data is completely secure. In development, on the sort of technology front, we're exploring new methods of online data collection, so kind of new ways of gathering insight from people. More conversational question styles, a little bit more discursive, a little bit more flexible, and also more seamless integration of data so that we can really kind of explore and integrate how we present data. So we've been very busy in the sort of technology space. The second area I wanted to flag is innovation in methods and approaches. I'm going to talk about two particular areas. And the first of these are our new community features. And my colleague Lou, who is sitting in the audience, has been instrumental in this. And George is now on board to help her with this. And again, absolute credit to this institute for the kind of vision and exciting sort of ideas around these functions. So what do I mean by a community feature? So as part of the sort of Discovery universe now, we have the ability to build private groups where people who are working together on a particular improvement question, a particular topic, can come and join and have an ongoing conversation about that piece of work. So you can see here, this is a demonstration, this isn't a real community. There's a whole series of different modules that you can turn on or off to meet the needs of the community. There's also a random picture of my cat who seems to photobomb most videos or other things. And so, for example, you know, within a community, you can have forums where people can talk, you can post resources, you can host webinars, anything that you might expect sort of, I've never been on Facebook, I have to confess, but Facebook-y, but private, secure, able to bring people together to have that conversation. And I think there's huge opportunities with these sorts of features. So it's really fantastic. Again, using this online space, people are busy, people are distributed, people might be engaging at different times of days, they might have missed kind of key meetings, they want to be able to see what's going on in this particular area of improvement. So I think it can bring people together to really sort of foster that network and collaboration. Really importantly, these features mean you can share your learning, you can kind of pool everything that you've been doing, you can really drive that insight development, and you should sort of cheerlead each other and sort of support and motivate if an improvement issue is thorny or difficult, you know, what's really working well for you, really motivate each other. Obviously, it means you can bring any number of people together at scale to have that conversation and really create that shared sense of belonging. So that's all very, very exciting, and we have our first community starting to develop right now. And the other area I want to flag is discrete choice experiments, and I'm really delighted that Becky is sitting in the audience because Becky is a researcher from the University of Cambridge who has a huge expertise in this area and has basically lent us all of her methodological expertise to build and launch our first discrete choice experiment. So what is a discrete choice experiment? It's a really powerful technique that's increasingly used across the health and care system. And it basically elicits preferences from people on any topic. So you're presented with a series of hypothetical scenarios, and each of them might have slightly different changes. And so what you're doing is being asked to choose, would you prefer A or B? And over a series of questions with a different series of hypotheses, you start getting a really strong understanding of why people are making the decisions, what are they really focusing on when they're preferring one thing after another. So this approach can be used, for example, to investigate the trade-offs people make between outcomes, can be used for priority setting frameworks, and look at the kind of things that are driving people's decision making. So as of yesterday, this beautiful and exciting project has launched, led by Becky and also with Juliet, who is also heavily involved in this project. And so this is open to any member of the public in the UK who is over 18. So if you want to take part and see what a Discovery project is like, then you will find it under our project pages. And it's really exciting. This project is part of a wider NIHR policy research unit on cancer awareness, screening and early diagnosis. And it's asking people to decide between the kinds of benefits and risks that are involved in cancer screening. So to give you a little sneak peek, there is a lot of text and beautiful explanation, I would say. But these are the kind of scenarios that we're talking about. So if you imagine you're invited to take part in cancer screening, and actually you could say, you know, no screening, or screening option 1 or screening option 2, and you can see that people are being asked to make trade-offs between what's most important, differences in the number of cancers that are diagnosed, differences in the number of people who might receive too much treatment when they don't need it. Those people, particularly, for example, who have a false negative as a result of taking part in screening. So Live Now, recruiting, open to you all. We're really excited about this method being brought to the platform and the team having worked to sort of show how we can do this. Also, just quickly to flag new information presentation options. And Mary was saying as well how, you know, Discovery as an online resource is quite useful for kind of hosting a video or something like that. We now have avatar videos, basically a really sophisticated animation. So this is with a service called Synthesia. And what happens is you feed in a transcript and your chosen person speaks it. This is an example from the remote kidney monitoring project that we heard about earlier. And we love this because you can present complex information really quickly. You can have sort of PowerPoint slides in the background. You can choose your person. They have Father Christmas if you would like a sort of Christmas-themed project. But they're incredibly low cost. And obviously, most importantly for us, when we're co-designing projects, when we're seeking lots of different opinions and views, we can change the script almost up until launch. So it's not the same as hiring an actor and recording a voiceover and then hearing from your patients and your clinicians that you're working with that they don't like that whole series of phrases. Here we can change it so we can be really responsive to people's needs, and I think that's really important. New question types. I think I've already trialed this a little bit. For some projects, the ability for people to contribute a video or an audio recording is really important. And that might be because of the participant needs, that actually typing isn't something they really want to do. Or it could be because of the methods. So for example, you might be wanting to gather audio diaries from people. We now have the ability to support this with a really simple to use question format where people can record video, audio, upload. You can AI transcribe it. You can natural language processing analyze it. You can get answers very quickly. Finally, what I wanted to talk about was design frameworks and mindsets. And so this is something more about what we've been doing internally at Discovery in terms of how we work to really deliver fantastic projects. So just to remind you, we have people with a question which needs answering. We have people with the expertise and experience to answer it. And we're aiming for this, delivering a great online project. And so we've been drawing on design thinking. So why is a design framework important? I hope you've reached the end of the day and realised that for us, collaborative approaches are everything. Hearing everyone's voices in the design of a project, as well as hearing everyone's voices actually in the data contributed to a project, is crucial. But obviously it's a bit messy sometimes. So being able to have a really clear design framework when we're working to put a project onto Discovery can really help with that. I think you've also heard from the Kidney Project, sometimes, you know, things can be delivered really quickly. Mary said 6 weeks for one of this Institute projects to go up on the platform. So we're often working really fast. We have really high ambitions for the standards of the projects that we're launching. The questions have to be great. The design has to be great. They have to be meaningful. They have to be engaging. So again, a strong roadmap to delivery means we all know where we're going and when we're going to get there. So we're using established, tried and tested design approaches to make sure we have the best results for our partners and also for our participants. So I think this has already come up, that good designs actually should be relatively invisible. You know, there shouldn't be any pain points. It shouldn't really aggravate you. It should just be easy to use. So we're trying to use approaches to make sure we take account of client needs, the wider user need. It could be absolutely anyone, but then for a specific project, you know, what do neurosurgeons need? What do, you know, people who have a certain accessibility issue need? So we're drawing on design thinking, user-centered design, and human-centered design principles. I'm not going to go into it here. You can find me afterwards and have a chat. We have some absolute experts in the audience. So I'm looking at Jenny and Ali up there. And what this means is we've been introducing a new project design system where we have 3 phases where we work with partners. We have an understand phase where we basically work out what does success look like for this project. Like, what are we aiming for? What's the North Star for this project? We produce a detailed project brief, we sign it off. We then go into the really fun bit where we have a load of really interactive design workshops. We're doing a lot of involvement of anyone who might be a target participant. We're exploring design options. We're producing prototypes and wireframes and getting everyone to interact and tear them apart and really come up with a brilliant final end-to-end project, which we then test and build and launch. And so throughout this, co-design is absolutely crucial, and Lou and George in our team are leading on this, really supporting the sensitive and meaning involvement of absolutely everyone who might take part in the project to make sure that it really works for them, presenting design options, ripping everything to shreds, making sure it works. So finally, I just wanted to end by flagging some high-impact projects which are quite new for us. They're in sort of different spaces. We're really excited about them. Obviously, the Discrete Choice Experiment is also one of those. I've already flagged that. Please take part. And the first one I wanted to talk about is a project working with a client called Orly. Orly are a fantastic new startup. They've just received significant funding from Innovate UK. They have a really clear ambition to make waiting better for parents, families and carers of children and young people who are waiting for mental health support. Now, obviously, this is sort of something that, in a way, all of us would prefer there not to be a need for a service that makes waiting better, but we all know that, actually, at the moment, the mental health system for children and young people is not working. And so what we're doing here is working collaboratively with parents and healthcare professionals and the Orly team. We're doing a lot of user testing of question types. And what we're asking for is to understand where people are in the system, what's been working well for them, what's not working well for them, really where are the pain points, but most importantly, how could new services come in and make that waiting in any way better for them? So this is a multi-stage project. This is the first listening exercise so that we really start to understand people's needs in this area. The second one is for RNID, who are a charity who support people with hearing loss. And this is to understand, again, in a kind of initial listening exercise, something that a lot of you probably don't think about very often, which is if you use a hearing aid because you have hearing loss and you go into hospital, it can just go missing. So either in admission or some point in your hospital journey, and this can have really profound consequences for people, including understanding anything that they're being asked to do, consenting to procedures, and it can go on after, obviously, they've been discharged and they still do not have this really crucial aid. Hearing aids are often made very specifically for people, so it's not something that's always easy to just, replace. So again, this is starting with a big listening exercise. When do hearing aids go missing? How? Why? What's the impact? But most importantly, working to design a solution to this problem. So we're working with the RNID panel of people with lived experience. They are actually all been specifically recruited because this has happened to them. So it's not just people with hearing loss, it's actually happened to them before. Our first meeting with them is next week with that panel. And again, this is to me the idea of gathering stories at scale, using these online approaches to really listen to people and build evidence and then start to work towards solutions. And finally, we're working with Alzheimer's Research UK on experiences of pathways to dementia diagnosis. Again, this is another example of where our system is groaning. Currently, only about 2/3 of people with mild cognitive impairment end up receiving a dementia diagnosis, waiting between 6 months and 2 years for this to happen. Alzheimer's Research UK have a big ambition to really understand more about what people are finding on their wiggly journey to actually receiving a dementia diagnosis. So they really want to know from people what happened to you, what did you go through, how did you actually get a diagnosis, or are you still on the pathway? Are you still waiting? So this is across everyone, people living with dementia, families, carers and healthcare staff, and it's very specifically to inform their campaigning, their policy, maybe their research funding decisions. We're co-designing this with, they're literally the best panel of people with lived experience. It's been an incredible experience for us and the team, and in terms of a kind of challenge of meeting the needs of these people in a way to contribute their expertise and facilitate them to do that. So, for example, audio recording of answers is something that for some of them is really important. So that's just a snippet of some stuff that's coming. Back to my favourite Disney songs. I do love A Whole New World from Aladdin. I'm hoping that maybe in a year's time, I'll be back with another load of exciting projects and another load of innovations. It really is an incredibly fast pace that we're working at. A lot of these things have just happened in the last 3 or 4 months. And so for that, I really do want to end by saying thank you, firstly, to the wonderful Insight and Innovation team who are all here today. So that's Lou, Jordan, Michelle, Jay, and George, but also to all of my wider colleagues, because we couldn't do it without all of our tech team as well. So Sophie and Andre, Makur and Avinash. You know, it's a really fantastic place to be for us at the moment. It's really exciting. So I hope that's given you a taste of what we're up to. Thanks.